Greetings, Internet people. You're tuned into the Keep It Real RN channel. My name is Craig, and I'll be your host. And today I'm going to start the first installment of my nursing story. And my nursing story starts out a long time ago. And in fact, it was the early 80s when my nursing story started. And when I graduated from high school, I really had no intention of going to college. In fact, the family I grew up in really had no expectation of me going to college, really. And all I really wanted to do was get a full-time job and get a car and get on with my life. And in the process of looking for a job, I saw an ad in the paper for dietary workers at my local hospital. And so I went down there and applied, and a few weeks later I got a call from the Human Resources Department, and the lady from the Human Resources Department said, "Yeah, I know you applied for a position in dietary, but we have an opening as a surgical orderly in the surgery department, and we're wondering if you'd be interested in that." And she asked me if I had a problem with blood or any of the types of things that I might see when I'm working in surgery, and I really had no idea if I had an aversion to blood or any of those kind of things. I'd never seen them before. So I decided that why not take a chance? Sounds good to me. And I went down and I interviewed with the head nurse of the operating room. Her name was Char Nelson. I'll never forget her. In fact, she was instrumental in me becoming the nurse I am now. Actually, gave me my start. And Char hired me, and one of my duties as a surgical orderly was to pick up patients from their rooms out on the floor and up in the ICU and bring them down to surgery. And so how that worked was, in the control room, they'd have a card with the patient's name and room number and some information on it, and they'd stick it up on a rack, and I'd pull it down and go get the patient and bring them back to surgery. Another one of my jobs was to help in the operating rooms in any way they saw fit, holding a limb, helping with anything that doesn't require a license, so to speak. And another one of my duties was, at the end of the day, was to take the list of scheduled surgeries for the next day and go into the supply room and get the packs and the supplies needed for the next day and stock the operating room suites. And in surgery, there was actually quite a few male nurses, considering it was the early 80s, and there really wasn't that many male nurses overall, but a lot of them tend to be concentrated in surgery. And that was my first exposure to nursing, as it were, from a perspective other than what you see on TV. And there were 3 guys that worked in surgery, and I remember them like it was yesterday. I remember their names: Terry Berger, Kevin Maxim, and Eric Knievel. In fact, if you guys are watching this, leave a comment down there in the comment section. But these 3 guys were people I kind of looked up to. I was 18 at the time, and these guys were like in their later to mid-20s. I remember Kevin was about 26, 27, married with kids. Terry Berger was divorced. He was like in his late 20s. He was a lot of fun. And Eric Knievel was the older of the 3, and he was like 32. He seemed old, but yet still hip. Eric was an older guy, but he was still hip and a super nice guy. And it was through those 3 guys that I started to see nursing as a potentially viable career. And my aha moment came one day when I was in the supply room with my list of surgeries for the next day, getting the supplies, and I'm pulling the supplies off the shelf, and all these supplies, these packs and towel. I mean, there's still towels and packs and instruments and all this stuff all wrapped up in surgical wrap. And they all had dates on them, and you had to make sure that you grabbed the oldest one first and use that. And that was kind of labor intensive, kind of tedious, as it were. But I remember thinking to myself, Self, do you really want to be doing this for the next several years? And I said to myself, absolutely not. And so I had been doing this job for just a little over a year, and I decided that I would go to nursing school. But what I needed to do is I needed to get my prereqs out of the way before I could apply to a program anywhere. I had a college right in my backyard, University of Minnesota Duluth, where I could take my prereqs at a very reasonable price. And that's what I did. I remember applying, getting into the University of Minnesota Duluth, resigning from my job as a surgical orderly, and becoming a student. Now, most of the kids that were at the college had started right out of high school, and I had taken a year off. So I saw things from a little bit of a different perspective than they did. But I remember my first day there like it was yesterday. And my very first class that I went to was at 8 o'clock in the morning, was chemistry. And when I had signed up for classes, they did not have any openings in the basic chemistry that all you needed was what you needed for nursing. The only chemistry they had open was this honors chemistry class that was geared towards chemistry nerds. And so in the interest of getting things rolling, I took this class. It was like one of the hardest classes I ever had. But I remember the very first day showing up at this chemistry class, 8 o'clock in the morning. And I got there early, and I'm sitting out in the hallway waiting for the instructor to open the door and thinking to myself, this is the first day of a very long journey. It's going to be a journey that feels like it's never going to end. And the funny thing is that this chemistry class had about maybe 20 people in it. It was very lab intensive. And like I said, it was full of chemistry nerds. These were people who were going to become chemical engineers, not nursing students by any means. And I remember struggling really hard, and the first test I got a B on, and the next test I got a C on, and the next test I got a D on, because this class was getting harder and harder and harder. And I got out of there with a C. And I was lucky to get that C. I had worked very hard for that C. And fortunately for me, the second semester, Chemistry for Dummies, which was all you had to have for nursing, had an opening in their second semester. So I got to take Chemistry for Dummies my second semester, which was a piece of cake compared to the chemistry for honors for chemical engineers. And I had a couple of years of chemistry in high school, and so basically the Chemistry for Dummies was just basically review, so it was pretty easy. So there you have it. That's the beginning of my nursing story. This is going to have many, many, many chapters. Some of them will be better than others, but you have to start somewhere, and that somewhere was at the beginning. So if you like this video, share it with your friends. In fact, share it with your friends, even if you think it sucks. Hit that subscribe button up there or down there and join us as a passenger on the Keep It Real RN Express. And until next time, keep it real.